Welcome to this clinical walkthrough on the post-bereavement insomnia case for UK MLA, brought to you by Medi8, your 24/7 practice partner.
Okay, let's dive right in. You're at your OSCE station. Your patient is a 60-year-old woman who hasn't been sleeping since her husband passed away 6 months ago. Your job? Take a sensitive history and put together a solid plan. This case is a real test of your communication skills and clinical thinking.
So, first things first, opening the consultation and building rapport. That first minute is everything. It's where you build trust and set the tone for the whole encounter. Get this right, and the patient will feel safe enough to really talk to you.
I'd suggest starting with this exact framework. It's clean, professional, and effective. You introduce yourself, confirm who you're speaking to, and then you open the floor with what brings you in today. It lets the patient start the story in her own words, which is exactly what we want. Now look at this two-step approach. It's so important. First, you show empathy. You reflect her problem back to her and say you're sorry she's going through it. Second, you signpost. You tell her what you're going to do next, and you ask for permission. That little phrase, if that's okay, changes everything. It makes it a partnership. All right, rapport is established. Now we move into taking a structured history. Having a system is key so you don't miss anything. We'll kick off with the sleep issue itself, and then dig into the other factors. These are your essential first questions. You need to know, is she struggling to get to sleep, stay asleep, or is she waking up too early? How much sleep is she actually getting? And how is it affecting her during the day? That last question is gold because it links her sleep problem directly to the bereavement, helping you establish a clear timeline. So, the cause of her insomnia might seem obvious, but we can't just assume. We need to sensitively explore the most likely culprits: her grief, her pre-existing rheumatoid arthritis pain, and any racing thoughts she might have at night. And here's exactly how you can phrase it. You ask for permission before you get into her emotional state that shows respect. Then, you directly link her physical health, the arthritis, to her sleep. This is a crucial skill, connecting the dots between different parts of the patient's history. Next, you need to run through a sleep hygiene checklist. These are all lifestyle factors that can be changed and can have a massive impact on sleep. You know, things like blue light from screens messing with melatonin or caffeine keeping our system wired for hours. Every question here is a potential area for improvement. Okay, this next part is non-negotiable. You must screen for an underlying depressive disorder and assess her risk. Grief and depression can look similar, and insomnia is a classic symptom of depression. It's our job to check this out. And again, use signpost. This phrasing is perfect because it normalizes the questions. You're explaining why you're asking, tying it straight back to her sleep problem. This helps prepare the patient and makes the questions feel less intrusive. You have to ask about the core symptoms of depression. You start with the two big screeners, low mood and anhedonia. That's losing interest in things. Then you explore the other symptoms. And you must end by directly asking about any thoughts that life isn't worth living. You have to ask to keep your patient safe. Think of the PMAFTOSA mnemonic as your personal safety net, and make sure you don't miss any background info. So let's run through it. We've touched on some of this, but you need to formally check her past medical history, medications, and allergies. Then you ask about family history, tobacco and alcohol use, her occupation, and her social support, which is so important now that she's living alone. Before you even think about a management plan, you have to check her ideas, concerns, and expectations. What does she think is happening? What is she most worried about? And what is she hoping to get from you today? She might be expecting sleeping pills, and you need to know that up front so you can manage her expectations. Okay, you've gathered all your information. Now comes the part where you put it all together into a clear diagnosis and explain it to the patient without using a ton of medical jargon. Your provisional diagnosis here is secondary insomnia. Secondary just means it's caused by something else. So you'll explain it clearly. You could say something like, "From everything you've told me, it sounds like the trouble you're having with sleep, which we call insomnia, was triggered by the grief of losing your husband. It also sounds like your arthritis pain at night is making it worse." This validates everything she's told you. You can practice this exact case right now. Get objective feedback on Medi8.com. Now, let's build the management plan. This has to be a shared decision. You're not just telling her what to do, you're creating a plan with her that addresses the root causes and feels achievable. First, let's address the sleeping pill issue head-on. You need to explain why they aren't our first choice, especially for older adults. You can mention the risks, like falls and confusion, and that they can be addictive. Then you frame your plan as a better, long-term solution that actually fixes the problem.
And here's the structure of a great plan. It's got 4 parts. This is a fantastic biopsychosocial approach. We're going to tackle the biological side with sleep hygiene and pain management, the psychological side with emotional support, and the social side by connecting her with resources.
Now you get specific. Give her concrete tips for sleep hygiene based on what you discussed earlier. For emotional support, you offer a referral. You can ask her, would you be open to the idea of talking to someone who specializes in helping people with grief? This puts the control back in her hands. We're in the home stretch. This final part of the consultation is just as important as the start. You have to give a clear safety net and a follow-up plan so she feels supported and knows what to do if things don't improve.
You can use this phrasing. It's perfect. The safety net gives clear red flags, her sleep getting worse or her mood dropping. And the follow-up sets a clear time frame. It tells the patient you're in this with her for the long haul. It's all about continuity of care.
So, are you ready to put it all into action? You can practice this exact case now on Mediate.com.